Hello, I am Jim Summers. I'm Chief Marketing Officer at CipherHealth, and I'm thrilled to be here today with CipherHealth CEO, Mr. Jake Piles, to talk about the many challenges and opportunities facing the healthcare industry today, and how health systems and providers can use patient engagement technologies to address them. Jake, you talk with customers, seems every day you're talking to customers. What are you hearing from them, and what are some of the challenges and the opportunities that they're dealing with today?
Yeah, Jim, as you said, I have a unique opportunity to talk to many different leaders across many leading healthcare systems across the U.S. On a daily, weekly basis. And there have been, over the last 6 to 9 months, several themes that have been consistent across those conversations. One that comes up first in almost every conversation I have is the nursing crisis and staff shortages and burnout. I think the industry recognizes that this problem existed pre-COVID, and they knew that the supply of nurses on the horizon were not going to be sufficient for the industry's demand or needs. And now COVID has exacerbated that problem and is leading to many nurses to leave the profession or retire early. And I think the industry also recognizes that it has played a part in some of that burnout. With the technology that they have put in place across the care continuum, the collage and using 10 to 15 vendors across the care continuum, it's not providing what the nurse needs to do her job more effectively. I mean, nurses at the end of the day want to be clinical care providers. They don't want to be doing administrative tasks. You hear stories about nurses, having to do appointment reminders, pre-arrival instructions, post-discharge outreach, all manual in nature, and it's just inefficient. And technology can be used to take those administrative tasks off their plates. Another big topic that comes up quite consistently is this area of consumerism. I think many C-suite execs and healthcare systems are recognizing that the expectations of how the patient/consumer, you're hearing consumer used more and more in the way they describe the patient, is beginning to change. I think they know that the experiences that the consumer is having in other spaces, your airline, your hotel, your bank, whatever it may be, the experience, the digital engagement experience you're having in those areas where they know who you are, they know what your interests are. They're serving things up to you. They're making the experience seamless and frictionless. They know that those expectations are now beginning to spill over into healthcare, and there are players starting to appear that they're making strides in those areas. So you're hearing more than recognize we've got to up our game as it relates to digital engagement, and that's becoming a priority. And it kind of ties into the third big theme that I hear, which is a changing competitive landscape. A lot of them, their eyes have been open to the moves made by Amazon and Amazon Care, Walmart and its health hubs, Optum opening 2,500 ambulatory clinics across the nation, CVS Aetna. I mean, you could go on, but it is clear the primary care model is being disrupted. And I think we believe that he who has the primary care relationship with the patient is going to understand a lot about what that patient needs, wants, and with that understanding, they're going to be able to steer and guide and direct where they go for additional services. So a lot of them talking about how do we engage that patient? How do we keep them engaged in our network? How do we create loyalty to them and not expose them to some of these new entrants into those areas? So creating more need to engage us to help them do that.
Well, it feels like today is a perfect storm. You've got the rising patient expectations, you've got the staffing issues and the revenue constraints that systems have been dealing with. And not least of all, we have COVID that is bringing this all to the forefront. And it's really accelerating the need for healthcare to digitally transform. So what is it about this digital transformation that are people new roles being introduced to really address this? How are people tackling this problem within the healthcare system in this perfect storm?
Well, I think, to your point, I think COVID has exposed the fragility and in some ways kind of the bureaucracy of healthcare.
Right.
And you've seen many systems kind of rethink how they go about making decisions and when you look at pre-COVID, there was a lot of committees involved in decision making. You've seen some of that break down through COVID because you can't go through a committee decision making process when you're having to make decisions in days, not weeks.
I recently read somewhere that healthcare costs are about 18% of GDP. I mean, that's not sustainable, right?
I think we as a nation have to recognize this is, to some degree, a crisis, because I actually read a report this week, two different interesting data points. One, there are people now saying that in 2021 that they think it might have been 20% of GDP. Mm-hmm. So as a country, this is not a sustainable model. And back to what COVID has done, I think it has exposed us as a system. People refer to it as fee-for-service, but it is, a reactive system. It is treating the condition that exists. And what I think we have to do is begin to rethink that and build a healthcare system and a patient engagement model that is proactive about managing the patient through their healthcare journey.
This is all very exciting, but there are literally hundreds of companies out there in this patient engagement technology space. Why should healthcare systems listen to us?
Well, Jim, I think, as you look at CipherHealth, I think we're uniquely positioned because no one else in this space can say they work with the type providers we work with. We have 350 of the top healthcare systems in the U.S. and growing. Mm-hmm. We're adding to that list on a weekly basis. Mm-hmm. But the breadth of the healthcare system that we cover and work with is unparalleled and unmatched, frankly, in this space. So that's one. Two, we have over a decade working in key areas like rounding and post-discharge outreach, deep history and understanding of what works and doesn't work in those respective areas. So we have been working on compiling and building a best practices approach to those two areas. Right. And we'll be expanding it to other areas. So I think it's like I said, the type leaders that in the healthcare system that we work with today, looking to us to manage some of these key areas of their clinical workflows, and the knowledge base that we have built around that. No one else has that today. Mm-hmm. So we are in a unique position as a result of that.
Well, Jake, this has been really great. Appreciate your time today and sharing your thoughts about what you're hearing from customers, the experiences that they're having, how they're using our software. And if any of you would like to learn more about CipherHealth and our solutions, please visit us online at www.cipherhealth.com and come visit our blog, read our stories, and read our many case studies as well. So thank you for your time today, and we'll see you soon.